Arigitani kuhitukira ciama ciao itiganite ni maniriire kuigamira thi ihinda-ini ria thiku 7 ciukite angikorwo micara yao ndigukorwo irihitwo. Solidarity forever. Hindi ya giikaro na andiki a mohoro, mwandiki munene wa kiama kia arigitani KMPDU Davji Atela augite makiria ma kaunti 40 itikoretwo ikiriha arigitani kuma mweri wa gatandatu mwaka uyu undu uria umahinyiriirie.
Today we have over 40 counties that have not paid June salaries and July salaries, and then we are in August. So we have united together as all the unions and saying that if these salaries are not paid within the next 7 days, then you should not expect doctors to be in the hospitals, you should not expect public healthcare workers, you should not expect the nurses, the clinical officers to be in the hospitals.
Ihinda-ini o riu no marutite mukana wa kwambika mugomo angikorwo arigitani rungu rwa UHC matigukorwo mandikitwo mawira ma gutura gugikinyeria tariki 1 mweri ukite wa kenda kuria morotete Ministry ya UGIMA wa MWERI ni thiaya kuona kigina kia arigitani aya gia shiringi bilioni 3.2 ni kiaheanirwo.
Now that we have the budgetary allocation that they used to say that they didn't have, our expectation is that by 1st of September, the UHC staff should have been confirmed and backdated to 1st of July because the budget was for the whole year. And if that does not happen, we are going to resume our weekly demonstrations until that happens.
Honorable Aden Duale, the issue of UHC should be disposed of by now. The money is there, but we are seeing a lot of bureaucracy.
Na riu ikinyairie makiria ma thiku 80 kuma arigitani maigamiro thi kaunti-ini ya Kiambu. Ciama ici ciugite ni kieha kuona thirikari ya kaunti no ndirenyenya undu uria maugite uracungiriria ikuo ingirigiriirio.
Ministers indicated to the Kiambu governor that by 1st of September, if the strike is not concluded, then it means the over 695 interns will have to be relocated or redeployed to other facilities. We have over 200 preventable deaths that have occurred in Kiambu County in the last 3 months, where they employed 44 new doctors there to handle cases that they cannot handle.
Oho ni mokiriire kambuni cia insurance cia motungata ma ũgima wa mwĩrĩ makiuga nyingĩ ciacio ikoretwo irongoreirie guthondeka mbeca handu ha kuiga ũgima wa mwĩrĩ mbere.
The biggest impediment to universal healthcare in this country are private insurance companies that have decided to get themselves into cocoon and dictate to the patients which hospitals to visit, they dictate to patients which doctors to see, they dictate to patients which lab tests to have, and they dictate to patients which drugs to be issued. This has become rampant across the country, actually acting to maximize the profit in the name of trying to say that they are improving care.
There are persistent challenges in regard to the SHA issue, and we want those challenges addressed with immediate effect so that we can be able to have that process running out smooth and clear.
Gerifotera Kameme TV ni Jetagwo Wagoi wa Mwirori.